Welcome, everyone. It's truly exciting to see so many of you interested in science. And especially, this is the very first time that we have a dedicated night for Persian students interested in the research. It's my great pleasure to invite Professor Peter Hegyi, Director of the PhD program and Director of the Academy of Europea, to give us his speech. We're truly honored to have Professor Hegyi today with us. Professor Hegyi, the stage is yours.
Thank you so much, Koorosh. And
Thank you.
Call me Peter as usual.
Sure.
As I don't know I can pronounce it well, but Norus Pirus. Was it a good one?
Yeah.
You're very welcome. Thank you for coming here. Actually, I always love diversity very, very much. Some people think diversity is not good. I think diversity is a necessity in life. If I look at backwards, like Persian has thousands of years history, culture, education, family, and everything which is there. So I believe that the diversity which is there especially can help people and can help everybody to grow. And what I learned in science, what I mostly enjoy in science, that I can meet people from completely different countries, from completely different backgrounds, from completely different education and family history. And whenever we discuss project, whenever we go forward, this is what helps to ask the best question, to perform the best research, and to get the best answers. If I look at currently what are the real global threats, either like global warming or cancer disease or dementia or diabetes, if I look at every country, it's everywhere. We have the same problems, we have the same challenges, and we have the same mind. Usually when I look backwards, that those Persian students I had the privilege to work with, like Koorosh, and I found really, really, really good people and really, really well-minded ones. So when he reached me out that there will be a night organized for you, I said, wow, may I go, may I go, may I attend, may I join, because this is what I really love. So I think what makes translational medicine, the Center for Translational Medicine, really very special, that we have students from everywhere. And if I look at the people, like around here, we have students from 34 different countries. If I look at there, they are the same. I couldn't identify a single thing when I can say that one country people would be a little bit better than the other. And I think if we uniquely can stand together to make the world better, this is what actually CTM about. So I am really thankful you are here. I am very thankful for having me. And I really wish that many of you at some point, either to do your own project, either to come for a master program or a PhD program, you will really join us. And I also would like to show you something about what we are doing, what is actually what we can give you. I think most of you are from medical students background. So you are studying medicine at Semmelweis University. Therefore, I felt a little bit important before you go to the details to introduce you a little bit that what is translational medicine. Because if I ask you what is gastroenterology, what is gastroenterology? Very good, brilliant. What is cardiology? Of heart. What is nephrology? Kidneys, brilliant. So you have immediately an idea. But when I speak and ask many students, what is translational medicine? I am a little bit worried to ask Koorosh or Amir because maybe they tell the wrong answer. They don't know the big. Therefore, I would like to give you a little overview what it is. If I want to tell you in really, really briefly, translational medicine is a scientific framework. What does it mean, scientific framework? You have different tools, methodologies, how to answer a question. And of course, it depends on your question, what kind of methodology to choose. In medicine, we can identify around 3 very distinguished different scientific methodology. One of them is discovery science, the other is translational research, and the third one is translational medicine. So the discovery science, I can give you an example like from Hungary, Katalin Karika, who just recently received the Nobel Prize. She asked a simple question, how the T cells immune response can be diminished if we change nucleosides in the RNA molecule. She found out the way, and the T cells stopped providing immune response for messenger RNA. At that time, she had absolutely no idea what will help in the future. She just generated a new knowledge in medicine. So discovery science generates a new knowledge. No Randy Sheckman, the Nobel laureate, will come. He discovered the vesicle transport from the cell to the cell membrane. Nobody knew at that time that this will lead, for example, insulin production in the 21st century. Today, 2/3 of the insulin are actually synthesized the way he discovered. But at that time, when he discovered it, he had not a clue. So discovery science happening in the lab, inside the lab, and the question is about like physiology or molecular things without knowing any kind of society benefit. We believe that having a new kind of tool, this could be helpful. What is the difference between discovery science and translational research? In translational research, you already have a question in disease, so you pick up this knowledge and try to find the disease you would like to use this knowledge. So I'm a gastroenterologist, so the best example to bring it up for you, like Barry Marshall, who received the Nobel Prize for discovering the Helicobacter pylori inside the stomach, which actually he discovered that in ulcer disease, there are lots of Helicobacter pylori. And during this discovery, he connected it with the disease and provided to medicine new therapeutic options. What is this new therapeutic options? It's antibiotics. Yes. So answering the question under a disease, having a new option, this is translational research. Both of them happening in the lab, but one of them creating new knowledge, the other one taking this new knowledge and provide a new opportunity to treat patients. But what about translational medicine? Translational medicine is not happening in the lab. It's not an idea to generate like new kind of therapeutic options. The main characteristics of translational medicine is to choose the currently available best therapeutic options for the patients. And the big difference between it, that the discovery science, you cannot predict the benefit, just having a new knowledge. In discovery science, you know that around 20, 25 years later, there could be a drug like cervical cancer in women. Now we give a vaccination against human papilloma virus because we know that this can be a main force for mutations. but it's after the discovery 20 years. In translational medicine, it's happening immediately, the patient's benefit. When you ask the question, when you answer it, immediately happen. The best example for that, you are at Semmelweis University, that actually Ignaz Semmelweis. Ignaz Semmelweis asked a very simple question. Why in one obstetrics clinic, 11% of women die after giving a birth? And why in the other clinic, it's only 1%? So 10 times different. One clinic, 11 of 100 pregnant women dies, and the other only one. This is a highly important question. He didn't go to the lab. He just set up a hypothesis, and the hypothesis was that during autopsy, the medical doctors bring something inside the women and infect them. So he didn't go down to the lab to find out actually a new therapeutic options against peripheral fever, but he said in his theory that why not washing hands before you examine the women? This is the very first action against microorganisms in the history of medicine. And within just changing the attitude, he didn't discover washing hands. You cannot discover it. But he discovered when to do it and how to do it. And beside his discovery, he could save billions of women's lives. So translational medicine is not going to the lab. It's happening next to the patients. You ask an important question. Should I give antibiotics or I shouldn't? Should I send the patient to a surgery or shouldn't? Should I perform ERCP on the patient or I shouldn't? So ask very simple questions in which you don't need to go down to the lab. So if I summarize the three methodologies, discovery science, you generate new knowledge. With translational research, you generate new options. And in translational medicine, you turn these options for your patient's benefit. You cannot be a good doctor in the 21st century without knowing translational medicine. It is as clear as it is. This is the only way to transfer it. But how you can do that? Do you need to choose between science and medicine? No, you don't. Because this is medicine, what you are learning now. And this medicine, actually, you practice how to do evidence-based medicine. But if you put this together in those clinics or institutions, irrespectively, it's Iran or Hungary or Hong Kong or New York, the best treatment is always given in a place where research is doing in a high level. And the reason is because you immediately can turn it there. But why is it important? Because we are doing very badly from the volume we have. Let's think about if we stop science today, and I would say, guys, you are prohibited to do science any longer in the world. God would say, or that you cannot do anything. What you can do, but if you use all the knowledge generated in the past, you would save billions of people. European Statistical Office made a very easy analysis. They looked at how many people die under 75 in Europe. It's 1.7 million. And they also looked at how many deaths could have been avoided if we use all the knowledge we generated in the past. And this is 1.2 million. Annually, Europe losing 1.2 million people's life because the society doesn't use the knowledge we generated in the past. So there is an unmet need to learn and to teach, to educate and to breed translational medicine. So how you can do that? If you are at a university level, you can learn clinic, like what you are doing, and you also can learn medicine, and you can do research. So during your study, you not only can get a medical degree, but you also can get a PhD. And also either during your medical degree treatment or either after as a PhD. And of course, what is the benefit of this? One of the benefits for the patients first, that during the patients will heal better immediately. And the university, of course, they can get more impact factors and citations. I am very proud to be a member of Academia of Europea. In Europe, Academia Europea is the largest and most distinguished academy. They have approximately 6,000 people, and 92 of them Nobel laureates. Usually there is no year when one of the members of Academia of Europea are not selected during the Nobel committee. And we could really proud that recently we developed in Hungary this translational medicine theory, which is very simple. With translational medicine, we can bring science immediately to society benefits. This is what was missing from the statistics I showed you. I just tell you 3 examples. This program was developed in Pécs. I don't know how many of you know where is Pécs. It's a southwest of Hungary. It's really a very nice place to be. And one resident doctor from Székesfehérvár County Hospital came down to Pécs and asked a very simple question: why we use 80% of the cases antibiotics in a disease of acute pancreatitis? Acute pancreatitis is not an infectious disease. So should we use 80% antibiotics in an inflammatory disease? I'm not sure. So we did a data analysis, and the data analysis showed clearly that the early rise of CRP and leukocyte level mislead the doctors, and we published it within 1 year. After this year, she went back to her own hospital and immediately started applying it for her own patients. And within a single year, she could decrease the antibiotics usage with 31%, and she could decrease the length of hospitalization altogether with 164 days. And the third year, she defended her PhD. So the beauty of translational medicine is that your patient's benefit comes first, then your own benefit. And this is not happening in discovery science or translational research. Another example, there is a disease so-called cystic fibrosis. Cystic fibrosis is a disease, the genetic mutation of CFTR, and if the patient has this in certain mutation, this can cause very severe mutations. And those doctors who were treating these kids asked a very simple question: why the parents bring these kids with visual impairment to the CF ambulance? And they found out that all of them were diabetic. So the visual impairment was developed due to diabetes, untreated diabetes. So they asked a very simple question: why don't we start screening them at the year of 4? Very simple question. You ask in a patient side. So they started it. What to lose? And within a single year, they identified 30% of the kids with abnormal glucose tolerance, and they set them up to therapy. They have been following this cohort for 4 years. None of the kids developed visual impairment. And now she just defended her habilitation doctoral thesis. Or other example, from the Boyci Hospital, which is nearby here, Semmelweis University, a surgeon, an otorhinopharyngologist, asked the simple question: there is a benign tumor of the air, which is also called cholesteatoma, and they realized, irrespectively how they operate it, there is a very high rate of recurrence. So how to operate? If I look at the textbook, there are 20 different operational methods, 20 of different pre-operational things. How to do that in the best way? And they not only found out that the mastoid obliteration is the best, they published it in one of the best journals, and the next year they immediately started using it in their own hospital. And within a single year, they could decrease with 13% actually the recidive rate of cholesteatoma. And the third year, Kata defended her PhD. So this is the real beauty of translational medicine, that your patient benefit comes first, and after your benefit comes. So this program, as I said, developed in Page, but when it's turned to Semmelweis University, immediately it burst out. And within 5 years, 434 students joined, from 34 different countries. And most of them were resident doctor or MD PhD students. Currently, we have over 10% students deciding to start their translational medicine PhD training here. And if some of you may know that the journals has a ranking there are almost 12,000 journals worldwide, which actually publishing scientific knowledge, and there is a ranking list. And among the ranking, far away, the best 200-300 journals are the top of each category. And if you look at these journals, we are regularly publishing the best gynecology journal, the best oncology journal, the best pediatric journal, the best gastroenterology journal, the best critical care journal, the best dentist journal. So all journals we can reach with this methodology. And also in the PhD, you have to write down why you started the research, as Imad Semmelweis for the free example, and you need to write it down how your research lead immediately for the society benefit. This is a summary of what we could achieve. First of all, we developed a huge educational material. This huge educational material, it's most of them e-learning. You can learn the basics of translational medicine. We also developed 17 workshops, which is one-day workshops, which can help you how to use the knowledge you learn during the e-learning. Our group is quite high. We have currently over 800 people affiliated to translational medicine. Also, Nobel laureates coming to give presentation next Tuesday. Randy Shackman coming from Berkeley. From 34 countries, we have 4 campuses now, one of them in Vienna, in Pécs, Szeged, and Budapest at Semmelweis. And the outcome is, I would say, any of the top universities worldwide would be proud of having it. We even have students from NYU, from New York University, and from the Chinese University of Hong Kong as well, which are among the top 50 universities. But what I am most proud from this number is this one, that among the 500 articles, 158 articles are cited in guidelines. What does it mean? That irrespectively where is the human being who get benefit from our research, either in Iran, either in China, either in Australia, either in Brazil or in the US, they get benefit from this research. Because now we treat the patients based on the guidelines. And I would like to show you a video because, as I said, we have a huge amount of Nobel laureates coming, how they think about actually, to close it, about this program.
Science is an indispensable element of progress and the future. Science changes lives where discovery leads to action. The National Academy of Scientist Education makes this happen through two programs. The Discovery Science Program, which focuses on nurturing future researchers, and the Translational Science Program, which turns knowledge into real-world applications.
Well, I think the development is fantastic. When I came first time, it was a program centered in Szeged, with students coming from different parts of Hungary. But meanwhile, the program has developed into two branches, and actually one of these branches aims at revolutionizing science education in all of Hungary.
Science really knows no boundaries. The important thing is that, you encourage it, you nurture it, you recognize it, you foster it. And this program surely does that.
I don't think you can be a good physician today without understanding science, without doing science at some time in your life, asking questions, critical questions, analyzing the literature.
The Translational Medicine Hybrid PhD program, launched in 2016, aims to provide healthcare professionals with the knowledge essential to translate scientific results to their patients' benefits. Since 2019, around 100 students, including doctors, dietitians, psychologists, and economists, have defended their PhD theses as part of the program. To date, more than 400 PhD students and 250 mentors from 36 countries have joined the international program. Recently, the program has accelerated significantly with the support of Semmelweis University, the government of Hungary, and Academia Europaea. Healthcare professionals have been able to demonstrably improve the quality of patient care in a short time, which, in addition to its positive social impact, has also resulted in cost-effective patient care.
If they choose to develop a career in science, they will have the view of the entire distance between the patient bed and the route to try and cure and help and develop drugs like we do.
Besides the several professional and social events, students of secondary schools and universities, as well as healthcare professionals, can attend the meetings of Nobel laureates and talented students, which are organized by the Academy twice a year. At the conferences, approximately 4,000 guests, pupils, students, mentors, doctors, and other faculty members can listen to scientific presentations of professional quality, participate in educational events, and meet or talk to Nobel Prize-winning scientists and internationally renowned researchers. Since the first meeting in 2012, the Academy has held 25 successful conferences with the prestigious participation of 21 Nobel laureates hailing from different parts of the world.
This program is new to me, so it's actually the first time I actually see Nobel Prize winners and other prizes winners to come close distance, almost one-to-one, to talk about their work with the students. So I think this model is very ambitious and very, very good.
First of all, I have a tremendous admiration and inspiration by what is done here through this program. This program is unique around the world. It's very special. It's not only going to improve Hungary, it's going to improve not only Central Europe, it's going to be a motor for progress, innovation, and a better world around the world.
The capital that you are building through this program, human capital, social capital, and potential economic capital, this is a great investment. And I really think that every country should have programs like this, and I think they should invest as much as they can afford.
Peter Hegyi convinced me that it's a good idea to train young people of the area of Szeged, and knowing Peter Hegyi, I know that he's very hard worker, very enthusiastic, and I just got infected by his enthusiasm. All I can say is that I'm very impressed, and I hope it continues like this.
Yes, we are really very enthusiastic. We are really hard workers. And we strongly believe that this will provide the new generation of medical doctors in the world. So you are very welcome in this history. If you want, you can join as a project student, as a TBK students. Some of you I already recognize that they are already in our program. Of course, you can start your PhD during your medical training and your medical undergraduate education. I think Koorosh will tell you later on the details. And whenever you have any question, we have an open door policy. You come up to the fourth floor and you can get answers to it. So thank you very much for having me.
Thank you very much, Professor Hegyi, for a very interesting talk. And now it's my pleasure to introduce you Dr. Moradi. Dr. Moradi is an Semmelweis alumni, and he also served as a chief resident and co-chair of research at Lake Hospital, Morrisoni College of Medicine, University of South Florida in the United States. And he has also several years of experience with the translational research. Dr. Moradi, it's a pleasure to have you here, and the stage is yours.
Hello, everyone. Do you have any voice?
Yes.
Can you hear me? Okay, awesome. So I'm very happy to be here. Thank you, Koorosh, for this amazing opportunity. And I don't know if Professor Peter Hegyi is still there. Thank you very much for this Department of Center for Translational Medicine. I don't know if you remember me, I was a student. I was a TDK student, and I was working with Dr. Lilik, Veronica Lilik. We published a project on iScience, which is one of the cell journals. I learned so much from you and from the team. I used to attend all the meeting like via Zoom, or if there was any in-person progress, lectures on research. So I'm very happy to be here. I have a presentation, if I can. Hello again. My name is Ali. I am currently a chief resident of internal medicine at Blake Hospital, which is affiliated with University of South Florida. I'm working in a hospital. I think we have around 400 beds, and we have more than 80 internal medicine residents. We are the stroke center in the west part of the Florida, and we are also burn center. So we have a lot of exposure to stroke patients, to burn patients. We also have cardiology fellowship in our program, and we have like really good exposure to cardiac cases. Of course, we have also different services like gastroenterology, hemonc, and other services as well. I'm also a co-chair of research committee in our hospital. Usually when you are in second year of your residency, you can, apply to be part of different committees. We have research committees, we have wellness committees, and as I was like participating in research projects and had like multiple presentation in different national conferences here in the US, I was lucky to be selected as a co-chair of research committee. So yeah, this is my picture, and probably some of you guys know me because I recently graduated from Semmelweis University. I graduated in 2022, and I started my residency in 2024. And since that time, I'm here in Florida, Bradenton, which is close to Tampa. Okay, so the first question that like medical students ask me about research is when to start research, because some of them, they are concerned that they don't have enough medical knowledge to start. But honestly, research is more about skills rather than medical knowledge. I was working with some of the USF science students, like they are doing their bachelor to apply for medical school. And they actually did a pretty good job, and I was very impressed. And at that time, I noticed that you don't necessarily need to have like significant medical knowledge. Some of the basic stuff would be enough, because it's more about the skills. You have to learn about the statistics. You have to learn about methodology, and you don't necessarily need that medical knowledge, I would say. And if you can start early on working on your research skills, that would give you a lot of benefits, like in the later stage of your medical education, because at that time you have some medical knowledge as well, and it can help you to come up with the ideas and applying those ideas. But it's also never late, if you are in final year of your medical school, or if you are already graduated, still it's not late to start. I remember the first project that I started was in my final year of medical school, and at that time I had no idea what I was doing. But I joined different research groups, and also I had a chance to work as a TDK student at Center for Translational Medicine, and I learned so much from them. To be able to do research, there are some basics that you need to know. For example, how to work with different research tools, how to write manuscript, how to use AI. It's a new topic that comes to the research, and we sometimes use those AIs in research. For example, there are tools for screening that I know we commonly use at Center for Translational Medicine, like Ryan. And there are different tools as well, which helps with different part of the research methodology. Okay, now that I'm resident, I'm so happy that I had a chance to learn about research when I was in medical school and also after my graduation. Because honestly, during residency, it's not really possible to learn from scratch, because you have a lot of responsibilities. Like I work about 70 to 80 hours per week. And it's very difficult to learn all those basics. But if you learn those basics in medical student or before your residency, it's gonna be very smooth. And at that time you have a time to come up with the idea and apply those ideas. So how to start research? That's the second question, actually. When you decide to start research, I remember it was like so difficult for me to find opportunities. Like I used to apply to different programs, reach out to different mentors, and they used to give me tasks that I wasn't able to do, and I never thought how to do. So that was the major issue, and I think Center for Translational Medicine did a great job, because if you work as a TDK student or PhD or master, you have access to all the educational content. So you learn, different stage from the very basic, step by step. And I really like that, because actually that was one of my first exposure to research. And after that, I was able to conduct my own studies, work with other medical students. So I think that's a great opportunity. And, the other thing that you can do is always reach out to the mentors that they are doing research, but make sure that you are researching to mentors that they already work with medical students previously, and they know how, most of the medical students, they don't have any exposure to research. So they don't know much about research, and some of the tasks might be hard for you in the beginning. But if someone is passionate about it and willing to teach you the basics, that would be the best case scenario. Other than that, whenever that you're joining project, the goal shouldn't be publishing paper. That's not a goal. The goal is to learn how to do those steps and how to conduct your own research in future. Because the point of getting master, doing PhD, working as a TDK student is to learn. You're there to learn, to be able to at some point doing your own research papers and your research work, and eventually helping patients. I feel like I am also mentioned finding courses. I believe you guys have great opportunity at Center for Translational Medicine, because as I mentioned, everything is very organized, and you will be able to learn things very systematically and in order. When it comes to research, and specifically medical research, there are different type of research. from low evidence, which is the bottom of this pyramid, to the like top of the pyramid. The basic type of papers are animal studies, laboratory studies. Whenever that a new medication, maybe like I saw that there were some pharmacy students that I know them from the past, are there. Welcome to all of you guys. They do laboratory studies, they do animal studies to find a new medication. But after that, they have to go to clinical trial and test those drugs. So those animal studies or laboratory studies are on the bottom. So they are not highly evidence-based, research or medication. So after that, they have to do different type of research. We also have like case reports when you find a cool case during your medical rotation and you want to present it either as an abstract or poster in the conferences or publishing it in a journal. That's also an option. I think it's a really good option for medical student. It's very easy. You can learn from it. It's not very complicated and very easy to publish those papers. So one of my first experience was actually doing a case report where I wrote that manuscript, sent it to my mentor. He gave me feedback and I learned from that. We also have like case control observational studies. Observational study means that we are actually either calculating risk factors or we are just observing. For example, there are some data from the past and you just observe those data and compare two different things for example, risk factor. If I want to give you an example, for example, you want to see if there is any risk of cancer with the smoking. So you can go to the databases, find two different groups that one of them smoked, one of them didn't smoke, and see like if they develop like lung cancer. Case control study is kind of same as cohort study. It's a bit different. You find, for example, cancer patients, and then you go to see if they smoke. Just the type of study is different. And observational studies can be retrospective studies, which means that you use the data from the past, or prospective studies, which means that you conduct to observe a study. And they are like, I would say, evidence-based, higher type of evidence-based research, but they are not like top evidence-based research. This is not something that's going to change the guideline. Like usually cohort studies are not able to change the guideline about something. You have to do more type of like studies or higher evidence of studies. For example, randomized controlled trial is one of the highest type of evidence-based medicine, research and publications, which means that you are giving patients medication and you're going to have like placebo group or control group, and you compare those two groups. But conducting randomized controlled trial takes a lot of time. It needs like huge funding because, you probably need to have a center to give those patients those medication. And the process is very hard and difficult. You need a lot of ethics thing to doing randomized controlled trial, and probably it's not really possible to do as a medical student, maybe as a research fellow or PhD student. After randomized controlled trial, the highest evidence-based type of research which are able to change the guideline is meta-analysis and systematic review. What does that mean? It means that you are, for example, there are 3 different randomized controlled trials in 3 different countries. So what you do in meta-analysis and systematic review is that you collect data from those 3 randomized controlled trials that was published in those 3 different countries, and you come up with the, higher number of like patients population. You increase the number of patients population. That means that you kind of increase the power of your studies, and you might be able to change the outcome. Maybe one of the studies didn't show any significant changes. One of the studies showed there was significant changes, but when you combine all those studies together, it can actually give you a better answer, because some of the problems with studies, with research studies, is something called p-value, which we say that the p-value is not significant. And it means that one of the possibilities is that the population, the participation was not enough, and the power wasn't good enough to show any significant changes. That's one of the possibilities. So that's why meta-analysis and systematic reviews comes, and they are higher evidence of research studies. And after meta-analysis and systematic reviews, for example, we do a meta-analysis and systematic reviews, and we notice that there are some changes based on the randomized controlled trial, based on the previous cohort studies. Then guideline might be changed. Guideline can be changed based on those studies. Sometimes guideline change based on just randomized controlled trial. Sometimes they change based on the new meta-analysis and systematic review. And whenever that you go to, for example, UpToDate, and you're checking the guidelines on the reference, you can see a lot of meta-analysis and systematic reviews. So these are the different type of studies. And my focus was mostly on systematic review and meta-analysis for different reasons. First of all, you have access to databases. For example, you can just go to PubMed, Google Scholar, Web of Science, and extracting your own data. You don't need to have access to patients' document from hospital. Your database is something that easily can be accessed through databases and when you are at home. So I think it's very beneficial. Other than that, it actually exposes you to a lot of research papers. So the way that systematic review works is that we have a pool of studies that you need to screen. So I remember when I was working with Center for Translational Medicine, I screen about 4,000 to 5,000 abstract and title. So it means that I read all those 4,000 title and abstract. And when you are reading, it gives you some idea about different type of research. Some of those studies are cohort, some of them are randomized controlled trial, and you kind of learn how other type of research works. And I think it's a very good way to be exposed to research and understand how the research works. So other than research, when you read a lot of research papers, it actually expands your clinical knowledge as well, because you are exposing yourself to papers and previous literature all the time, and you learn every day. It's not just that you are doing something to publish a paper. You're actually learning unconsciously. Other than that, systematic review and meta-analysis is the best way to learn about a statistic, because you want to extract data from other papers and bring it to your own paper, to your own research. So in that way, you kind of gonna have some understanding of statistic concept, what is hazard ratio, what is odds ratio, and it makes sense when you're actually doing that. I know the name looks difficult, it's hard to understand. I was the same. I didn't have any idea about the statistics, but when I started doing this meta-analysis, I kind of learned how this statistics works by just doing hands-on experience, and whenever I remember when I was in medical school, we used to talk with other students, and sometimes they come up with some new idea, and especially in discussion, it's very also common in residency that you always ask residents. Now that I'm chief resident, I work with interns and medical students, and sometimes they come with plan and assessment. And when they come up with something new, I ask them, so how did you come up with this new plan and assessment? For example, they want to start new medication. And sometimes they tell me that there was a new studies that showed that this medication can be beneficial. And then I ask them, okay, what is that paper? And they show me one cohort studies from 10 years ago, which wasn't really significant. So, when you already know research, when you already work in systematic review and meta-analysis, one of your capabilities is to understand how reliable is that study and how how evidence-based is that study. There are more things that you're gonna learn, and one of the major things I remember when I started research, my first question was how people come with the research idea. I can join, but I don't know if one day I can come up with my own, research question. And when you do tons of, when you read tons of papers doing your systematic review, then it actually brings you some idea. You're gonna have some idea about research, because all the papers, they have one part called limitation, and in that part they mention what are the weakness of their paper, and they also recommend what future studies should be on, and based on those things you can actually come up with your own idea. So I think it's really good if you're in your if you're a medical student or you're early in your career, start your research with systematic review and meta-analysis. And my experience with Center for Translational Medicine was I had a chance to meet one of the lecturer at Center for Translational Medicine, Dr. Obeidat. And he was kind enough to offer me to join one of the projects at CTM. At that time, I was a TDK student. I joined that project, and we went through all different steps of systematic review and meta-analysis step by step. And I kind of learned the methodology, how to screen, how to check for the publication bias, how to check for different type of bias. And when you go step by step, you can kind of learn. And after that, I was able to doing my own research project. So I think Center for Translational Medicine, we are very lucky to have them at Semmelweis University. I think they can help you guys expand your research exposure and also learn more. And eventually, you're gonna publish paper with them when you join their project. For example, I have a paper on acute pancreatitis and cardiac complication after acute pancreatitis, which we publish in D1 journals, iScience, which is part of the Cell.com, which is very famous. You guys have an opportunity. I highly recommend to join as a TDK, or if you can join as a PhD student. When I was medical student, like in my fourth year, I'm not sure if Center for Translational Medicine was working at that time, but I didn't hear anything about it. So if I was in my fourth year, I would definitely join them as a PhD student, because I think while you're getting your MD, you can also get your PhD and learn about research in very systematic manner. About residency, as I mentioned, residency is very demanding. Currently, I'm like on ICU 9, and I go to work at 6 p.m. till 6 a.m. It's very demanding. Like you work 70 to 80 hours, and when you're at home, you don't really have time to learn research from scratch. You are able to join projects, you are able to come up with your own idea, and if you already know what you are doing, it's much easier. You can do them. But I know a lot of residents in our program and that they want to do research, but they have no idea. Make it hard for them. Start early on, and you will get a lot of benefits from that. You can present your poster in national conferences, making connections, and go from there. I want to say happy Persian New Year, happy Nowruz to everyone. I'm gonna say that in Farsi. امیدوارم سال خیلی خوبی داشته باشید. خیلی خوشحال شدم چند تا وقتی داشتین، الان من نمیبینم آدینس رو، ولی خیلی از بچه ها رو وقتی داشتین عکس میگرفتین دیدم. خیلی خوشحال شدم چهرهاتون رو دیدم. بعضی دوستای صمیمی من هستن و از کوروش عزیزم میخواستم تشکر کنم. امیدوارم سال خیلی خوبی داشته باشید و به امید آزادی کشورمون. نوروزتون پیروز. Thank you very much for having me, Koorosh. If there is any question, I will be more than happy to answer.
Thank you, Arash. It was a very insightful presentation. So now I'd like to continue by sharing a little more information about the program at the Center for Translational Medicine. So how many of you, I mean, when you fill out the form, I could see most of you are interested in the TDK, which I will explain at the end. And I think this would be the most useful for most of you. But is there anybody who are interested in PhD program? A few? Because if nobody interested, I can maybe skip this part of the PhD program. But okay, so I will quickly just mention a few things about this. And if you have more question about the PhD, you can always come and reach me. And I'm always available. You can send me an email also, and we can discuss this further just to save time, and we could shorten this as much as possible. So just a little bit example of the PhD program here at the CTM. So traditional way, I will give you an example of a tire change. So immediately you can see who is the supervisor and who is the PhD student. The problem is that this old way takes a lot of time and a lot of energy, and most of the time actually the supervisor is even absent, and it's basically the PhD student who has to figure out all the methods and every research questions they have. The other methods, or the new way, is to have this so-called Ferrari model, where they can change all the 4 tires in a relatively very short time. Less than 1.8 seconds, they can change all the 4 tires. And the benefits comes from the teamwork and using the latest technology. So if you think about it, here at CTM, every student, they have the dedicated time for the project. And then there is a supervisor who have the knowledge in the clinics, and they are surrounded by a team of experts. For example, the methodology supervisors, the informatic groups, the biostatistician, data manager. And if you are interested about any topic, for example, let's say you're interested in doing research in space science, we can actually find experts in the space science, and we actually have Amir project was actually in space science, and we can find experts in those areas. So I will skip these parts. I think so. Basically, the point is that if you publish 2 papers within the 2 years, you can actually defend your PhD instead of 4 years by only 2.5 years. And here, not only you can do your PhD and develop academically, but also it's good for self-development. So a portion of the PhD student, they can become an SMS, which means that basically they can get around nearly 10 students each year, and every student they get a co-authorship in those papers. So I have around 10 students. I have 4 papers myself, and I have 15 papers which will be published with them. So within a very short time, within 1 year, you can have a lot of publications, which is very good. And after you defend your PhD, you can also become a supervisor and get PhD. So these are the formats of the PhD program. And the main point is that there are 5 elements, basically. There are group meetings, class meetings, lectures, seminars, project meeting, and etc. The main point is that if you are TDK students and you are interested in any of the topics, you can actually come to these group meetings, talk to the supervisor, talk to the PhD students. Anytime, it's free, and you can talk with them and get involved in any of the projects. So the structure of these group meetings is that so we have different group meetings based on different subjects. I will show you the schedule of these group meetings at the different slides. It takes approximately 2.5 hours to 3 hours, and all the students, they discuss the projects develop, and they get the feedbacks. There are project meetings. So if you decide to become TDK students, basically I'm saying this TDK students, but anybody who is interested to get involved in the research are welcome, even if you are graduated. I had several friends who were graduated from Semmelweis. They joined as TDK students, and they could actually publish with these. So these project meetings are online. For each PhD student, it takes approximately half an hour. Basically, it's with the PhD student, their supervisor, and their SMS. And if you decide to join as a TDK student, the 90% attendance of this project meeting is required. Basically, this is the only attendance requirements. There are also classes, which basically is for PhD students twice every other week. There are online materials and there are workshops. So I can skip these parts. And there are also lectures given by distinguished guests or Nobel laureates. Twice per year they come. And every one of you are welcome. Actually, next week we have several distinguished guests. You can actually fill out the form next Tuesday, the same place. You can meet 2 Nobel laureates. So if you're interested, anybody is welcome to come. If you need to scan the QR code, just let me know later. I will show you the picture. And finally, there are progress reports. So basically, in the first year, this is the only way that we assess the PhD students. In the first year, there are basically 4 progress reports every 3 months. And basically, it's also for students to practice the presentation skills and also to evaluate their work. And from these project progress reports, all of the videos will be uploaded into the YouTube. So not only they can be watching themselves, but also they can learn from others as well. And the program actually launched in 4 main campuses. So Szeged, Semmelweis, University of Vienna, and also the Page University. So this part, fortunately, I don't need to tell you because Arash discussed this part very well. The only part, so these are the different steps of meta-analysis, and these are the different possibilities for you if you decide to join. So we have undergraduate programs, which are MSc program. If you have, for example, a gap year, you can learn the methods, all these, 1 year, and instead of doing other projects, because this is basically the MSc program is exactly the same as PhD. The only thing is that the only requirement is to submit 1 paper. You don't need to write any thesis. And it's basically exact same thing. You can learn all the methodology in 1 year. There is also MD PhD program. So if you are 4th year, 5th year medical or DMD or pharmacy students in the last years, you can join. And by the time when you graduate, you can also have your PhD. There are PhD postgraduate program. There are PhD program, hybrid PhD program, which is basically for Hungarian. So here in Hungary, if you actually do your PhD in the topic that you are interested in, for example, let's say you're doing it in dermatology, you can do your residency 1 year earlier. So instead of 5 years, you can do the residency in 4 years, because this is recognized as part of your residency. So this is basically for Hungarian. In the first year, they only need to go 1 day to the work while they're getting paid, 4 days of research. In the second year, it's the opposite. They go 4 days for research, 4 days for work, 1 day for research. And finally, there are also some certificate program, summer program, and the winter program. So the main advantage I wanted to say is actually the TDK program, which I wish this program existed when I was a medical student, because it's free. So you get workshop. There are workshops that are provided for you for free. You can learn the methodology, basics of how to do meta-analysis. This is the same thing that PhD students have to pay. Almost, if you're a Semmelweis student, you have to pay 10,000 euro per year. If you're a non-Semmelweis student, you have to pay 20,000 euro per year. So basically, it's provided for free, and it's, I think, a great opportunity. And everyone here should use these opportunities, because not only you get publication, you learn the methods, and even if you decide later on to join as a PhD student, you already know the methods. It's much easier for you to do the same methodology, to do the same type of research. So basically, the requirement for joining as a PhD student is quite easy. English language exam, which almost, I think it's not needed for you because you're already studying in English, motivation letter, and a topic of description, what you are interested in. And for if you want to become a supervisor, basically the only thing requirement is to be a PhD, to have a PhD. So there are different ways that you can apply. And even if you don't know, if you're not sure about how to apply, we have also future webinars. So you can just scan the QR code and also scan the web reminder. We have the same basically boring lecture that explained all of these, and you can also get the help from us for your administration. So for the TDK program, we have two options. So one of the option is that there is 1 credit in the Neptune offered. You have to attend all the project meetings, and basically, if you decide to join as a TDK, you have to participate in 4 parts of a meta-analysis: the data selection, data extraction, risk of bias assessment, and the grading and article writing. If you participate in all these 4 parts, and you also have a 90% attendance, you're getting a co-authorship, most likely, because it also depends on the supervisors, and you have to have a good relationship with them. So if everybody's happy, you also get a co-authorship. And if you decide also there is another options that the CTM provide the workshop for you, these options only available in the summer, in the autumn semester. So there are 2 credits and there are 5 workshops. So basically you can even just come to the workshop, don't even join a project meeting, don't even join a project, just to learn the methods. It's for free, and I think it's a great benefit to learn the methods. So if you're interested about our projects, if you don't know where to start, if you're interested in different projects, this is the QR code for our project book. Every single PhD students and their supervisors list are there. So you can look, you can even go to our website, check the project book, see which topic you're interested, and then come to the group meeting, go discuss with them, and get involved in the research. So this is the group meeting schedule, as I mentioned. So these are mostly for first-year students. So for example, critical care, we have also the miscellaneous. The miscellaneous, we have dermatology student, ophthalmology, ENT, and I'm also in the miscellaneous group, and we have other groups. So if you're interested in any of these, just come to the group meetings, discuss with the SMS, discuss with the supervisor, with the PhD students, and you can. So the thing is, with the TDK, we have the call for TDK students at the next September. So most of the students right now, they already have a TDK students, and it's also quite competitive. So the earlier you go, if you talk with the PhD students, you get involved, then it's like based on first come, first serve. So you can get involved in the project. Many students ask me about the scholarship. There is a scholarship option available, but this is a bilateral agreement, meaning not only Hungary has to approve it, but also Iran has to approve it, the Ministry of Health Educations. And I know one person who actually got it last year, so I don't know. I don't want to tell you how many if it's possible really or not, but it's an option. So you can apply. The deadline usually is the 15th of January the year before. So if you get the scholarship, a stipendium scholarship, the tuition fee is free, but also on top of that, you get a salary of around 180,000 forints per month, and like a 2,000-3,000 euro for buying a laptop or etc. There is another option, ECOP, which is basically provided by Hungarian government. Approximately it's 180,000 forint per month, but this is also highly competitive. So the requirement for this is to have published article, submitted article. Mostly last year, everybody who already have published article, they could use this. So if you join, once you are second year, third year, have a published article, and if you decide later on to join as a PhD, you can benefit from these. There is another option. I don't want to give you false information, but if you have a European citizenship, a blue card, the tuition fee, I think most likely is free. So I see there is a student actually who works in a residency program from the Page. He has a blue card, and the Page hospital actually pay for his tuition because he has a blue card. So if you have a blue card, if you have a European citizen, the program is also free. And the video was already shown by Professor Hegyi. So, and here we have the Q&A session. So if anyone has some questions, we can answer the question. So if you can, please, if you have any question, you can raise your hand, ask the question, or you can scan the QR code and ask the question. Thank you. Okay, then it was a long night, right? So before we close this session, I would like to thank you all for coming tonight. And I'd like to acknowledge that I know this year Nowruz feels a bit different, but New Year and Nowruz remind us that not all the winter lasts forever. And after every darkness, spring returns with hope. And in the same way, I truly hope that peace and freedom and brighter days will come soon for the people of Iran. Thank you again, and happy Nowruz, Nowruzatun Piruz. And in a few minutes, I will invite for you to listen to the traditional Persian music performance, which is performed by a group of Iranian students, including Nima Saeed Moqaddam, Dorsa Monabbati, Navid Nawabzadeh. And I hope that you can enjoy the music. And after that, you're welcome to enjoy the wine and cheese session and the sweets. Thank you all.